on the subject of get most out of your. Sairam brothers and sisters, welcome to today's healthcare webinar on the subject of getting the most out of your medications. I have great pleasure in introducing you to Brother Nainesh Patel, who is a qualified pharmacist from Bradford University and have been a pharmacist for over 30 years. Initially, Brother Nainesh worked in a hospital pharmacy for a few years and then started in community pharmacy, holding various managerial roles as well as locums. He has his license to work as a pharmacist in Florida, and currently he manages a community pharmacy in South London. Brother Nainesh was fortunate to have grown up in a Sai household and has attended the Sathya Sai Center of Tooting since the late 70s. Currently, he is the center's spiritual coordinator. Brother Nainesh has served as a pharmacist in overseas medical camps in Zambia, Sierra Leone, India, Nepal, and Sri Lanka. He has also served as a pharmacist in the international camp in Prashanthi Nilayam for Swami's 70th birthday and led the pharmacy team during the youth pilgrimage of 2004. I now hand you over to Brother Nainesh. Sairam.
I offer my humble pranams at the lotus feet of our beloved Bhagwan Sri Sathya Sai Baba. Good evening everyone, and Sairam. My name is Nainesh Patel, and I'm going to talk to you this evening about medicines, how they work in the body, and how you can get the most out of them. So what is a medicine? Medicine or drug is any chemical or biological substance that affects how the body functions. Some would argue that food is a medicine. In fact, food has an impact on how the body works. Swami says, the food that we eat has an impact on our physical, our mental and spiritual fabric. However, today I will just focus on non-food related medicines. To do this, it helps to have a bit of understanding of what goes on in our body, how things work, and how things may go wrong. A number of factors have an impact on how effective a particular medicine is and how effectively it gets to where it's meant to get to. These processes can be governed by four major components of effectively delivering the medication into the body. Firstly, we need to get the medicine into our body from outside. We can do this by a number of ways. The most common way of getting the medication into our body is by taking it orally, as a tablet or a capsule. There are other ways as well, as an injection, or as a liquid, as an injection into our blood vessels or through our muscles. You can also take it as a special tablet which dissolves under the tongue. All of these ways get the medicine straight into the general circulation. However, we may not want to treat the whole body. We may only want to treat a particular organ. In which case, sometimes, not always, but sometimes we can use particular types of medical devices, such as an eye drop, nose sprays, ear sprays, mouthwashes, suppositories, vaginal pastries, skin creams, inhalations into the chest, etc. These target specifically organs. Absorption of medicines by each of these routes is governed by many complex processes. To give you an idea how complex the system is, I'll just go through the route of one particular type of medication. So just looking at the oral route and a tablet, what happens when we swallow a tablet? Firstly, it goes down the food pipe and hits the stomach. The stomach is a bag of acid and enzymes, about the size of a small fist. However, when it expands, it can hold up to 4 liters of liquid, mainly acid and enzymes. Main role of the stomach is to break down food into smaller particles and also destroy anything that's been eaten which is nasty. The tablet, that can be that you've just taken undergoes a similar process. It's broken down into smaller particles by the stomach fluids and dissolved. It then moves on from the stomach into the small intestines. Small intestines aren't actually that small, they're about 6 meters long. And the main role of the small intestine is to absorb food that has been broken down into small amino acids and fatty acids and glucose. The 6 meter long intestine, which is wrapped around itself and leads from the stomach to the large intestines. This is where most of the medicines are absorbed as well. The intestine wall has lots of gateways which prevents or which governs how much or what chemicals go from the stomach, from the intestines into the blood and vice versa. These gateways are a bit like farmyard gates, where they only allow a particular size of animals through, like a dog or a cat or a horse, etc. Once our medicine enters the blood, it needs to be distributed to the sites of actions. It needs to be delivered. This process of distribution occurs mainly through the circulatory system or our blood vessels. The circulatory system is like a road network of blood vessels that traverse the whole body, and it transports and delivers essential chemicals to keep us safe and functioning well. In simple terms, the medicine just hitches a ride in the blood by attaching itself to blood proteins. That way it gets to where it's meant to get to. This journey from the intestines to the rest of the body is governed by many factors. Again, things like how fast the blood is flowing in the vessels, i.e. how hard the heart is beating. It's also governed by how strong the bond is between the medicine and the protein in the blood which is binding to. The tighter the bind to the blood protein, then it gets to the site of action better. However, it will be harder to separate at the other end. If it's a weak bond, then it may. Our body has a number of barriers. These barriers are designed to prevent toxins getting to where they should not go, but also allow free movement of nutrients and essentials. The drug that we're following has already encountered a barrier between the intestines and the blood vessels. However, there's two other important barriers we need to look at when we look at our drugs. Firstly, the blood-brain barrier. The brain is governed by such an important organ that it's protected by its own layer of blood vessels, blood cells and brain cells. The blood-brain barrier protects the brain from invasion by toxins and pathogens, and it only allows the movement of the most simplest, purest and fat-soluble substances in both directions. There's another barrier, which is a placental blood barrier. This is composed of both mother and fetal tissue, and it protects the embryo whilst it's developing in the womb from toxins and pathogens. Another component of the drug delivery model I was showing you earlier is how the drug is detoxified or broken down so that it no longer has an effect on the body. This process of detoxification is called metabolism, and most of it is done by the liver. If you look at the picture on the right, we see most of the blood vessels from the gut don't go to the heart. It goes first to the liver and then to the heart. This is a unique way the body has designed itself to protect itself from any toxins that we may have ingested. The liver is the largest solid internal organ of the body. It filters and takes out the nutrients and glucose that the body keeps and stores for future use, but it also renders unwanted and harmful toxins and renders them inactive by various chemical reactions. This process is called metabolism. Liver conducts over 100 different tasks a day. Depending on how a drug is. Once a drug passes through the liver, it goes on to the heart, and from there it is pumped on around the body and eventually ends up at the target organ. This is where it's meant to work. It does its job, but then we need to get rid of it. If we don't get rid of it, we can get a build-up of the drug in that area, and which could lead to side effects. This process of elimination is an endless task, majority of which is done by the kidneys, and it's to remove toxins and waste products from the body. This is done either as urine through the kidneys, or as gases through the breath, or as sweat through the skin, or as bile through our feces. So how do drugs work? In a nutshell, drugs work by chemical reactions in the body. However, there are different ways these chemical reactions can occur. For example, in a bacterial cell wall, antibiotics can incorporate itself into the bacterial cell wall and destroy the bacteria that way. You also have drugs that attach to receptors in the body to overstimulate them or to stop them working. For example, blood pressure tablets or blood pressure medicines block the action of certain neurotransmitters to prevent your blood pressure from going up, i.e. to keep it low. There are drugs that mimic naturally occurring hormones that occur in the body, such as levothyroxine, which is used to treat people with underactive thyroid. Then there are also drugs which may block the normal functioning of tasks by deceiving the body into thinking that the task is no longer needed. As you can see from these four processes of absorption, distribution, metabolism and elimination, you can affect and influence how effective your medication is. For example, if we want a medication to treat ulcerative colitis in the small intestines, we need to protect it from the stomach acids with a special enteric coating. If we want to have a slower acting tablet so that you need to take less of it, you need to make it in such a way that it dissolves slower in the body. Hence, you can affect how a medication works by tweaking the manufacturing process. You can also influence the distribution of a drug by looking at how it's soluble in blood, how it bypasses the liver, or how it is metabolized by the liver in the first pass metabolism, or how it is bound to blood protein. For example, you can bypass the first pass metabolism by injecting a drug or by taking it sublingually. This avoids this oral first pass metabolism process. The liver carries out over 100 different tasks throughout the day for all your life. The state of our liver has an important factor in how it metabolizes, or how our body metabolizes drugs. People with liver failure are not able to metabolize drugs effectively, and it can lead to a buildup of toxins and drug products, leading to side effects. Also, medications may interfere with other medications or with various food items, leading to a build-up or low levels of drugs which are ineffective. For example, grapefruit juice contains an enzyme which affects how some drugs are metabolizing, making a build-up or a depletion of a drug, depending on what it is. Our lifestyle has a big impact on our life, on the state of our liver. Alcohol will destroy the liver over time and can lead to major problems. If we're unfortunate enough to have liver failure, drug doses may need to be drastically reduced levels. Elimination of drugs by the kidney is affected by many factors, such as the state of health of the kidney, fluid intake, blood pressure, presence of other diseases such as diabetes or infections, and the presence of food and the age of the patient as well. Humans are lucky. We have been born with 2 kidneys. Most people will live a normal healthy life with just 1 kidney. However, if that packs up, then they have big problems. They have to undergo dialysis to remove the toxins from blood. Dialysis is basically attaching yourself to a artificial kidney outside the body to remove all the toxins from the blood. But it also removes the good nutrients and the antibodies that are in the blood as well. It's not as effective as a kidney. Which means that unfortunately people who undergo dialysis are more prone to infections because of this. Kidney failure means that if you have kidney failure, the doses of medicines would need to be drastically reduced. Otherwise, you can get build up of toxicity. People with kidney failure have to undergo fluid restrictions, the amount of fluid they take and how much of it they take each day. Medicines can cross the placental barrier or pass into breast milk from the mother, and they may be detrimental to the health of the child. Because of this, we need to take extra care when we're giving medicines to expectant mothers or breastfeeding mothers. Human beings need the greatest amount of care and looking after when they're either newly born or as a child or when they're very old. As you age, your body undergoes various changes which affect how it handles medicines and how they're absorbed or used. For example, changes in the digestive system could affect how fast a medication gets into the blood. You could have changes in body weight, which would influence the amount of medicine that is available to work in your body. Some elderly people have problems swallowing, which has an impact on their body weight. They may not be able to drink enough water. They may be on fluid restriction. That also has an impact on body weight. As you get older, unfortunately, you tend to not want to drink as much fluid, which has a big impact. Other diseases could be a problem. Also, kidney failure, liver failure has an impact as you get older. Poor circulation, alcohol intake increase, and of course memory problems. All of these have a big impact on how medicines work as you get older. Because of these body changes, there's a bigger risk of drug interactions for the elderly. Drug-drug interactions occur when 2 or more medicines interfere with each other to cause unwanted side effects. This kind of interaction can also have an impact on how one of the medication may work, may make it less effective, or may make another drug more effective. Drug condition interactions occur when you have a medical condition which has an impact on how it can handle other drugs. For example, patients who are on blood pressure tablets or hypertensive should not be taking decongestants because there's an increased risk of blood pressure going up. People on warfarin or blood thinner should not be taking aspirin because there's an increased risk of a bleed. You can also get drug-food interactions between the drugs that you have to take and the foods that you enjoy taking, such as cranberries or grapefruit juice, which interferes with some blood pressure tablets or some cholesterol tablets. Always check with a pharmacist if you think there's an interaction. Always read the label and always check the leaflets that's been given. What are side effects? Some medicines can interact with other medicines, with other foods, with other drinks, with other conditions. Side effects are unplanned symptoms or feelings which you don't want when this happens. Most side effects are not serious and can go away on their own. Others, however, are troublesome and some even serious. To help prevent possible problems with medication, it is good to know about the medicines and to understand how it works in the body and how it makes you feel. Keep track of the side effects in a notebook if you get any, and keep track of how it's happened, what you were doing at that time, if you'd taken your tablets or missed your tablets. That way you'll help the doctor get a better idea of what's going on. New symptoms such as mood changes you may not be aware of may happen. They may not be a result of you getting older, but may be a side effect of a medication. Changes in diet routine, changes in how your body reacts to medication has an impact on the side effects. Always, if you're unsure, ask your pharmacist or ask your doctor. He'll be able to give you some good advice. It's very important to always read the label of the packaging and to understand your medication and how to take it. Incorrect myths about medicines. Number 1. If you're really hurting, you ignore the label and take more pills. An extra dose won't cause any harm. That's incorrect. The truth is, if you take more than the dosage on the label, it could hurt you. It could be very harmful. Myth number 2. Once you feel better, you don't have to keep taking your tablets, especially with antibiotics. If your symptoms are gone or your medication hasn't gone, you may be tempted to stop taking the medicines. Don't. The doctor's given you medication because you need it. With antibiotics, if you stop taking your medicine halfway through a course, there's an increased risk of the illness recurring or the bacteria getting resistant to the antibiotics, which could cause more problems. Myth: natural symptoms, natural supplements and vitamins are always a safe choice. Wrong again. Natural does not always mean safe. Natural does not always mean healthy. For example, some of the most toxic cancer medicines are derived from natural sources. Doesn't mean it's safe. That also goes for medicines, Ayurvedic medicines from India, which people may bring over. If you're unsure, don't take it unless you know what you're doing. Natural is not always safe unless you know what you're doing. Myth number 4. It is best to keep medicines handy in the bathroom or kitchen sink, near the bathroom or kitchen sink. That's wrong, because medicines will degrade quicker in warm, wet environments. So the bathroom cabinet or the kitchen cabinet is the ideal place for it to stop working quicker, for it to become less effective. You should always keep your medicines in a cool, dry place, away from bright lights and away from children. It doesn't matter how you swallow a pill, as long as it gets there where it gets to, it doesn't matter. That's wrong again. We talked about that earlier, about how it's important you take your tablets as the label dictates. If you take a tablet and you crush it, it may not work as effectively. You should only take your diabetes tablets if you have a dessert. This unfortunately is the thinking of a lot of the elderly people in the South Asian community. If they have diabetes, they'll take an extra tablet if they've eaten an extra laddu, or they'll only take their blood pressure tablets if they're feeling stressed or if they're feeling tired. This is the wrong way of treating yourself, because your body isn't able to control the disease properly. If you take your diabetes tablets only when your blood pressure or your blood sugar levels increase, then you're at risk of having problems all the rest of the time. If you take your blood pressure tablets only when you think your blood pressure is high or when you're stressed, then you're at greater risk of having a stroke because you're not taking your tablets correctly. My wife's prescription for the same ailment can help me. No, definitely not. Because at the end of the day, if the medication was prescribed for you, it should be for you, no one else but you. It shouldn't be taken by your wife or your brother down the road because he's got the same symptoms. He may have the same symptoms, but he may not have the same disease. Myth number 8. Receiving flu injection can give you flu. Truth. Although some people may feel unwell after a flu injection, it is impossible to get flu from a flu vaccine, because the vaccine is made from dead inactivated virus. Dead virus cannot replicate. The only small chance is the kids who receive the nasal vaccine, they get a live version and they may get risk of getting flu, but even that, the chances are very, very small. However, you may get flu after a vaccine if you get a different strain of flu, which isn't covered by the strains that are in the vaccine. The flu, there's so many different strains of flu that not all of them are covered by the vaccine that you have, and you may get a flu from another strain of virus. Myth number 9. The internet is the source of all knowledge regarding health. Nope, definitely not. Depends where you look on the internet and what you read. However, the internet is not the source of all information or knowledge. Dr. Google gets it wrong quite often. Do not believe everything you read on the internet, especially if you go to websites which are not regulated. Some trusted websites. These are ideal for looking up good for some general health information. Also, be very cautious when you buy medicines over the internet. To stay safe, only buy medicines from a pharmacy website that posts the General Pharmaceutical Council Internet Pharmacy logo. This is important safeguard which protects the consumers from not knowing the origin of the medicines that they are buying. Contrary to what most people believe, pharmacists don't count tablets all day long. They are the professionals who are legally allowed to supply medicines in this country. They know how to make them, they know how they work in the body, they know what happens when things go wrong. Pharmacy students in the UK study for 4 years plus 1 year as a pre-reg. During the pandemic, the community pharmacies were the only healthcare professional that didn't shut its doors. You could get free advice, unbiased, from your local pharmacy without having to make an appointment. With a nationwide shortage of GPs and long waiting lists, pharmacist skills and knowledge is being used to ease the pressure on the NHS. Community pharmacists in the UK provide a range of free services that help reduce demand and get patients treated sooner. The government has recently commissioned a national blood pressure screening program to try and find undiagnosed hypertensive patients. Anyone over the age of 40 who's not taken blood pressure tablets can go to their pharmacy and get their blood pressure checked for free. Some pharmacies give flu and COVID vaccines for free. There's a free consultation service which GP receptionists can refer patients to their pharmacy for minor conditions and minor ailments. This frees up GP appointment time slots for patients who need them the most. Pharmacy staff are trained to direct patients to appropriate healthcare providers if they're not able to help. Most community pharmacies provide other extra services, such as a free service such as an NMS service, which is new medication service. This is to prevent problems occurring in people who have been started on new medication. It involves a consultation with the pharmacist free of charge, just to make sure that there's no issues, no side effects, or to help catch them before it gets too bad. Pharmacists work in GP practices as well. Many of the pharmacists who work in GP practice are actually independent prescribers. This means that they can prescribe medication without being referred to a GP on their own and take responsibility for it. They provide a vital service, supporting their GP colleagues, ensuring that the patient has a proper clinical, seeing patients in clinics, conducting medication reviews, checking blood results, diagnosing, treating, referring and supporting practice. You have pharmacists work in hospital. They have a unique clinical role to advise junior doctors as well as consultants to ensure the most effective treatment is provided. Pharmacists work in the drug manufacturing industry to ensure that the highest quality of medication is manufactured. And of course, there are pharmacists who work in teaching hospitals or who teach the next generation of healthcare providers. Medicines. Do not hoard them. These are dangerous chemicals which are expensive as well. It is important to only order prescriptions from your doctor if you need it. Don't stockpile medicines thinking that they will run out. If you're not using something, don't keep on ordering it out of fear that your GP will think you're not following his instructions. It's a major waste of NHS resources, and the GP will probably be happy that you've told him that you're not actually taking your medication and why you're not taking it. Do not throw your tablets away in the normal waste or down the sink. This is unsafe and not good for the environment. Unwanted medicines can be returned to any pharmacy for destruction. You may think it's such a waste. Why throw it away when it can be used in a third world country if it's still in date? This is because the medication may have been tampered with or may not be stored properly, possibly making it ineffective. Four questions to ask your doctor or pharmacist when you prescribe a new form of treatment. It's important to have confidence in what you're taking or what you're undergoing, and in order to do that you should ask these four questions. What are the benefits of a treatment? What are the risks or the side effects of having the treatment? Are there any alternatives? Can I get a second opinion? What happens if I do nothing? Will I fall down dead tomorrow? Whatever it is, what's the worst that can happen? Patients have rights. It's important to know your rights when it comes to medication. You should always understand your medication. You should always ask your healthcare professional for advice on your medication. You have a right to understand what's been prescribed to you. Make sure you get the most of your medicines. Take them at the right time. Take them the right way. Look out for side effects. And make sure you have enough and don't run out. Always read the label and keep away from children. Let me end with a quote from Bhagwan Baba. The secret of perfect health lies in keeping the mind always cheerful, never worried, never hurried, never worn down by any fear, thought or anxiety. Jai Saram, and thank you for listening to me.
Sairam, aunties, uncles, brothers and sisters. My name is Harsha and I'm an academic pharmacist. I'd like to begin by thanking Nainesh Bhai for tonight's really informative webinar. So we're going to start with some questions if that's okay, and we've got a few that we'd like to begin with. So our first question is, if I am prescribed medication for cholesterol, is it lifelong?
I'm Harshavan. Hi. Okay, so there's a short and long answer to that. Depends why you've been prescribed cholesterol tablets. If it's for high cholesterol, then you can, if you're able to control it with your diet, then you might be able to cut it down and reduce the dosage. However, if you're, say, a diabetic and the doctor's given you the tablets to prevent a stroke, then you may be having on it for a long time. Yes. So there's a yes and a no to that answer, I'm afraid. That question.
Well, thank you. And so the next question that's come through is, why does it take so long to collect my medication? Surely all you do is print the label and stick it on the box.
We get asked that quite a lot, so, usually by people who park on the double yellow line outside the shop. We don't just pick tablets off a shelf and put a label on it. We have to check the PMR, check the patient's records, make sure the tablet doesn't, or the medication doesn't interfere with whatever else they're taking. And it is very busy right now these days. Doctors don't always send prescriptions on time. There's a number of factors, but it isn't just picking something off the shelf. We process the pharmacists go through 4 years of the degree program, and it's not just, we don't learn that just how to stick a label on a box of tablets there.
Absolutely. Thank you very much. So our next question is, when I buy a medicine over the counter, why are so many questions asked of me?
At the end of the day, you're buying medication for yourself or your friend or family member. But as a pharmacist, we want to make sure that you're buying the correct thing, the safest thing for yourself. That's why we always want to make sure that the questions we ask is for your benefit. So for no one else, we're not interrogating you. It's not as a policeman asking questions. It's to make sure that what we give or what we sell is best for you. That's why we just need to ask those questions, really.
Okay, thank you. Our next question that's come through is, I take lots of tablets and pop them out at the start of the week to help remember what to take. Is this safe?
In short answer, no. Because most of the tablets are colored white, a large portion of them. You don't actually know what you've popped out after a few hours. You wouldn't know what's what. By popping them out, you're also increasing the chance of being contaminated by other things, dust or pet hair or anything else that's in the household. So it is important you keep them in its containers so it's safe. But then if you need someone to help you remember your tablets, there's ways the pharmacist can help. They can hopefully, if you go and speak to your pharmacist, he or she should be able to guide you in terms of setting up a dossier box, maybe, if that's what you need. A dossier box is where your tablets laid out by a pharmacist so that in a weekly tray with all set up Monday, Tuesday, Wednesday, Thursday, and times of day. So you don't have to remember to take it. So you don't have to remember when to take what. So it's something that your pharmacist should be able to help you with if you're going to speak to them.
It's really helpful. Thank you.
Yeah.
Another question that's been asked is, can a pharmacist review my medication? I think I take too many tablets and want to cut down.
Yes, definitely. Pharmacists know all about tablets, all about medicines. We used to be, in the past, pharmacists used to conduct medication reviews a lot, but now we don't do as many because of the way the NHS contract's been set up. But GP pharmacists that work in GP surgeries do a lot of these medication reviews. They will go through your tablets thoroughly, see what you're taking, see what you don't need to take, and hopefully de-prescribe some of these for you if you don't need it.
That's really helpful to know. Thank you. So our next question is, why are some medicines taken before food and others are taken after food? Does it really matter?
Yes, it does. I think I was mentioned that in the talk, but a bit of IT issues I think may not have come across properly. Medicines work differently in the body. Some medicines absorb better in the stomach when there's food present. Other medicines, if there's food present, they don't get absorbed and they pass straight through. So it all depends on how it dissolves in the stomach, in the small intestines. So yeah, it is very important you follow the directions on the label. Don't go outside those directions thinking that you know better. No, the labels, there's years of research that has gone into when you should be taking some medicines and when not others, sort of thing. It's like thyroxine you should take first thing in the morning. Things like aspirin and ibuprofen you should always take after food because it can give you tummy upsets if you don't. And then some antibiotics you take after food, while others you take before food. But always read the label.
Okay, thank you. So our next question is, I have regular monthly medication. Some of it is creams. I don't need my creams every month, but the pharmacy keeps on sending them. What shall I do?
Okay. Medication in the country is supplied by the NHS. The NHS is short of resources, it's tight on budget. Don't order prescriptions if you don't need it. If a pharmacist is sending medication which you don't need, maybe inhalers or creams which you don't need every month, phone him up and tell him, look, don't send it to me this month. Or tell him that you will phone him when you are due to, or when you need to some more supplies. That way he doesn't keep sending it to you and he only send you your tablets or something.
Okay, thank you. And our final question that's come is, I don't read English very well. Where can I find out more about my medicine in a language that I can understand?
Many resources for translating medication or translating medicine labels and leaflets. Speak to your pharmacist. They have links to various translators in the NHS, as well as there's translated material available on the internet as well. But don't always go for the first thing on the internet. As I said before, go find a reliable source. Patient.co.uk is a very good first website, I'd say. But the pharmacist should be able to tell you where you can get good translated material. Speak to your community center as well, because some temples, some churches, some mosques, they have someone who can translate for you as well there.
Okay, that's really useful and helpful advice. Thank you. So this concludes our webinar this evening, and we'd like to thank Swami for being with us this evening and guiding and guarding each and every one of us. A huge thank you to you, Nainesh Bhai, for putting together such an informative presentation and being so patient and answering all those questions. We'd also like to offer our thanks to Dr. Upadhyay, the lead for the Healthcare Committee, and also to the media team for helping to support this webinar and for giving us the opportunity to share more about pharmacy. Thank you to everyone at home who's watched this, and we hope it's been helpful. We look forward to joining you for the next webinar, which will be on the first Tuesday in November. Sairam.
Thank you very much, Siobhan.